Welcome back. I'm here today with Dr. John Gould, and we're going to talk about three topics that are very, very interesting to me. We're going to talk about Botox for the face, Lasik for the eyes, and Latisse for the eyebrows. Welcome.
Thank you, Jackie. Thank you for having me.
Thank you very much. Now, tell me just a little bit about yourself. I know that you're an ophthalmologist. I get that. I can't really pronounce that word, so you have to pronounce it for me.
Ophthalmologist.
Okay, and what exactly does that mean for somebody who doesn't know?
An ophthalmologist is a physician who's gone to medical school, done an internship, and then done an additional 3 years of training such that they can treat and deal with diseases of the eyes using either medicine or surgery or both.
Okay, and you also perform Botox?
Yes, I do.
Okay, and can you tell me a little bit about exactly what is Botox?
Well, Botox is a chemical derived from a bacteria that has the effect of interacting with what's called the neuromuscular junction, or the connection between the nerves and the muscles, such that it effectively turns off the nerve, which has the effect of turning off the muscles. So in a short way of saying it, it has the effect of limiting muscle function and limiting the pull that a muscle does, and thereby decreasing lines and decreasing wrinkles that would occur.
So it can make me look fabulous.
You already do, Jackie.
Oh, thank you. You can come on my show again.
Thank you.
Okay, now who's a candidate for Botox? Who can get Botox? What do you have to do to get Botox?
Botox is normally limited to the age of 60 and over, so it's not done over 60. The average person receiving Botox is probably between 30 and 45 or 50, in that range. Much under 30, it's really not that necessary. Over 55, there are other things going on in the skin where it's less effective.
Now, where exactly can one get Botox? Is it just in the face, like we see on TV, or can they get it in other parts of the body?
It can be used for a variety of things. The cosmetic aspects that most people are familiar with are usually just in the face, although it can also be done in the neck and some of the issues there, or areas there. It can also be done for excessive sweating, believe it or not. So some people will receive it in the armpit, in the hand, things of that sort. But the bulk of it that's used cosmetically is from the neck up.
Okay. And what results can someone expect from Botox?
Well, Botox works quite well in reducing the effect of lines that occur. Not every line, because in some circumstances the lines are from a loss of tissue or loss of tissue elasticity, but mostly used in the horizontal lines that can occur in the forehead, sometimes the vertical lines that people will have around their nose, or sometimes in crow's feet. And those are the areas where it's used most commonly.
And how long can Botox last?
It depends on the person. Botox normally will last 3 to 4 months, sometimes a little longer, sometimes a little less. But the more it's done on a regular basis, the effect of it lasts longer then.
And are there any side effects of Botox?
Very few, other than obviously the side effect that people are looking for is the loss of contraction to eliminate or erase the line. Properly done, there are very few side effects. There can, in some circumstances, be drooping of the eyelid if the eyelid muscles themselves, rather than the brow muscles, are involved. But that's not common. And one of the things that's good about Botox is that were somebody to have that complication, it will wear off as the Botox wears off.
Okay, thank you very much. Now, how much does Botox typically cost?
Well, pricing of Botox depends on where it's done. It's done and administered by the unit. So some practices will charge a certain amount per unit. Others will charge a certain amount for an area. As a rough idea, doing the total brow area will roughly run $250 to $300 for a treatment. Doing the area between the nose, the vertical lines in the nose can be similar. Crow's feet can be a little bit less.
And is Botox covered by insurance?
Not usually, no.
Okay. Would there be any conditions where it would be covered by insurance?
Botox for cosmetic purposes is not. In some of the uses where it's used for medical problems, it's also being used for migraine, things of that sort. It can be covered, but the things that we've discussed are not normally covered by insurance.
And how long would it take when you go into a physician's office for the procedure?
The procedure itself isn't too long. The preoperative evaluation, the pre-Botox evaluation, the total amount you can count on probably 45 minutes. Have to sort of map out where the lines are, have to discuss what the patient's thoughts are on it, what their expectations are, go over some of the potential for complications. But it's not a long, arduous procedure for people. Now
the key question, does it hurt?
It's never hurt me at all. Oh, the patient. It's to say that people don't feel anything would not be accurate. But people And I always ask them, are almost always surprised how little discomfort there is. We use a topical type of an anesthetic, a little dab of a cream. The needle that's used is extremely small, thinner and finer than any that you would normally have been exposed to. And the volume that's used is very little, and it's not put in very deep. So it is a little pinch, and I'd be not being truthful if I said there was no pinch. But most people, when it's all said and done, are very surprised how little it hurt.
And how long after you have the Botox procedure can you see the results? Is it immediate or a couple hours? Or?
Usually several days, actually. It
Really?
takes a
Okay.
while to work and to get integrated into the tissues. So immediately there's not a result, but several days later there are. And what we normally recommend is once somebody has it, then they return in roughly 1 to 2 weeks to see if they need a little bit more to make sure that they have enough to attain the desired effect.
And how does somebody go about finding a physician who does Botox?
Well, as with anything with a physician, your best bet is referrals from friends or people you know who have had it, or people that you know that have done it, or people that are reputable in it. My general viewpoint is that the more physicians advertise, the more suspicious I am of advertising. So friends and colleagues and family is probably your best way.
And what is, I guess, for a physician who engages in the practice of Botox, what is their certification process? What do they have to go through to actually be allowed to do Botox?
Well, the primary thing is to be a licensed physician with appropriate malpractice insurance, appropriate licensure. There are courses that are involved with Botox, and one takes the course, and there's a certification process after that.
Okay. And so anything else you'd like to tell us specifically about Botox?
No, I think, well, I will. The biggest mistake in Botox, and the reason it's become almost a joke in many circles, is the mistake that you can make with Botox is to get too much.
Okay. I definitely know that face.
Exactly. And like so many things, if somebody has had Botox and they go to work maybe a week later and people say, oh, gee, she had Botox, that's not right. The goal you have is somebody goes to work and they say, gee, did you just come back from vacation? Or is that a new outfit you're wearing? Or golly, you look better today than usual. And that's the goal. So to completely, totally erase any lines or any expressivity is probably a mistake and not the desired goal, in my opinion.
Now, after you Botox, can you put makeup on your face? Can you put creams on your face just like you would in a normal?
Certainly.
Okay, so that's possible. All right, well, let's move on to our next topic. I want to talk about this eye stuff that we've been seeing, these commercials for making your lashes grow long. I think it's called Latisse?
Latisse, yes.
Latisse. Now, what exactly is Latisse? What does it do? What are the...
Latisse is a fascinating product because it's the exact same chemical as one of the glaucoma medications. And when people were using it as a glaucoma medication, they noticed as a side effect that the eyelashes were getting longer and longer. And so the company formulated it slightly differently and had a different applicator such that it can be essentially painted along the lid margin, along the lash margin, and it promotes eyelash growth.
Now, what are some of the side effects of using this product?
Side effects of that are there can be some hyperpigmentation or some darkening of the eyes. There can be, well, there is the lash growth, of course. In some cases, if it's allowed to spread, if it's not washed off properly or applied properly, there can be some darkening of the pigment, which turns out to be darkening kind of under the eye. But properly used, there's very little side effects.
Okay. And how much does it cost?
Latisse is not inexpensive. I think that, depending on where you buy it and such, it's in the range of $100 a month.
Okay. And once you discontinue using it, will your lashes still stay long, or?
No. As they grow out, they'll grow out, and you'll go back to the, whatever your pre-Latisse situation was.
Now, one of the questions people have asked me is, can you use Latisse on your eyebrows or other parts of your body that you want hair to grow?